My name is Wojciech van den Brander. I'm the Operations Development and Effectiveness Director for Nuffield Health, which is a UK-based health and wellbeing charity. I'm here to talk to you today a little bit about our digital front door strategy, and in particular how TrakCare is helping enable that front door to speak to our strategy as we go forward. Great, so welcome everyone to Nuffield Health. This is a bit of an overview about who we are. We are the UK's largest healthcare charity. We've been operating for over 60 years, and we've been focused on supporting the UK to become fitter, healthier, happier and stronger. We do that through a large network of different centres and different service lines that people can access. That include 36 hospitals, 114 fitness and wellbeing clubs. We call them fitness and wellbeing clubs because they are not just gyms, they contain healthcare clinics that often focus around primary care, and also 125 workplace wellbeing settings where we provide some sort of service, whether that is fitness or healthcare, directly in a corporate setting for the companies that we work with. So as a charity, we don't generate any dividends or any profits for an owner. We invest all of our income back into our services. We look at anything that we can push our purpose and our drive around improving in care, and most importantly in increasing our flagship programs, which is the way that we give back to society. It's all part of our mission. We really do care about building a healthier nation, and we are completely focused and driven by that. And I hope over the course of the next couple of slides, you'll start to see a bit of the way that we measure ourselves and how we are an unusual prospect in terms of a digital front door. So we're guided by our purpose, and in 2020 we reached 1.25 million people. That was a disrupted year, as you can imagine, and we are hoping to more than double that in the years to come. Our purpose really comes across three particular principles. We offer a unique connected healthcare approach. So there are no other people that I know of that are able to connect a patient's ability all the way from becoming healthier and staying healthier through to diagnosis, through to intervention, and finally through to rehabilitation and even end of life. And we are able to offer that with our particular network of services and facilities that we have available to us. We measure everything that we do. We measure it based on the quality that we're providing patients. So we want to make sure that they are receiving the best services and that we are leading the market in terms of the outcomes that we provide. And the ability to do that is incredibly important from a digital point of view. Not only is it a key enabler, but also there is the ability for us to reflect that information back to our stakeholders to help them make some decisions. And I'll go more into that a little bit later. And finally, we address unmet needs, particularly through our flagship programs. So where there is an unmet need within society and we know that the healthcare system or the healthcare economy cannot provide for that need, we will step in and create a flagship program. There are a number of examples, most recently around long COVID, where patients and beneficiaries who have had COVID are suffering continuous and ongoing symptoms. We are uniquely placed to offer them a fitness wellbeing program in the context of a health setting within one of our wellbeing clubs to give them that extra level of support. So to deliver our public benefit, we concentrate on three particular areas: healthy environment, healthy work and healthy communities. In all three of those environments, we focus around the ability to research, educate and meet unmet needs. There are a few really driving principles in the way that we are approaching these three areas. We look at accessibility and inclusion. Traditionally in the UK, private healthcare is seen as the preserve of the wealthy. It is usually something that only a certain number of people can afford. We're breaking that mold. We're talking about accessibility and inclusion within the services that we offer, whether that is from primary care through to fitness, all the way through to intervention within one of our hospitals. And we know that if we do that and we give that access and that inclusion, that we provide a better social mobility for patients to rise up through those socioeconomic standards to meet them. Healthy environment is really important to us. So we all know within the greater world that we're talking about how companies can position themselves to be more environmentally conscious. So our carbon footprint, our recycling and waste, and our sustainable healthcare is really very important. Healthcare is a huge waster of resources. So and we are changing the way that we're approaching things in order to meet that healthy environment challenge. And actually our ability to collect data really efficiently and make ourselves more efficient and reflect that out to the patients will give us a way to better control those points of wastage within the system. And then finally, healthy work. So we're uniquely placed within the system to reach directly into the workplace to support people, because largely of our services that we provide within those offices. And we know that with the right setup and with the right information, we can provide healthy well-being environment that drives diversity and inclusion. And we know that given our very broad remit and our ability to collect very detailed information, we'll be able to provide education and professional development unlike anyone else can do. And all of that rounded together will help drive public benefit, which is the thing that gets us out of bed in the morning. So how do we measure ourselves in terms of public benefit? Again, this is important for the context around the digital front door. So we don't measure ourselves by traditional financial metrics, EBITDA or anything like that. We measure ourselves primarily around the social return on the investment that we make. And we do this through looking at a few different scores. We look at what is the quality adjusted life years that we can provide to the individual, what is the life satisfaction around the family and the carer, how much money have we saved the NHS, and more importantly, if we get that beneficiary back to work and working hard, what is the expected earnings that we've generated from increasing that return back to work. So finally, I just wanted to call up a bit of a statement around our digital front door. So we really very strongly believe that the digital front door will drive our public benefit through the enablement of data ownership and the creation of citizen data scientists in our ecosystem and beyond. So there's some very key phrases there, and in particular, the citizen data scientists. So data science has traditionally been the preserve of the boffins and people sitting in dark rooms with very large computers. We want to democratize that, particularly amongst our very large workforce, and let people use data to power their decision making. And we can only do that if we give both internally and externally the ability for people to see, act and manipulate their data. And then finally, we know that we are part of one small cog in a very large healthcare system. So we need to be able to transfer data and talk to each other. Now, much of that is being driven by the NHS, and they are pushing forward common data standards and things of that nature. But we feel that there is a responsibility to allow the most accessibility of the data that we hold for people, so that they can use that in their decision making throughout their lives. So we've got a couple of slides, a couple of busy slides here, and I do apologise for that, but I do think they are important to describe how we're approaching this. So we're going to ensure that all of our beneficiaries will be able to access their own personal data ecosystem, and that not only will that hold all of the data around where patients and beneficiaries have contacted us and come in contact with us, but also that we can make that data available to the right people within our own internal ecosystem at the right time, and that data in particular will support the best outcomes possible. And we're going to do that in a few different ways. So wherever we collect that data, whether that's from prevention through to diagnostics or rehabilitation, we know that that data ecosystem should be completely and utterly agnostic to the system or to the software where that data is collected. So we're setting up an infrastructure to be able to do that. And TrakCare is so vital to helping us collect that data. What this will do is, if we have the right data, we have it in an agnostic place, we can use this to facilitate three really important things. So the first thing is that the care that we provide can be person-centered based on their total and holistic data profile. That person feels empowered to share in their decision-making with the clinicians involved and all the fitness experts involved. And that finally, we as managers and as stewards of this charity can use this evidence to drive our decision-making and organizational intelligence to make sure that we are fulfilling that purpose and driving forward the activities that we know are important. And then finally, with that data and with the right system, we can really start to become very agile in the way that we harness continuous improvement in order to continuously maximize that journey without having to restart very large change programs on each basis. That is the direction we're headed. Where we are on that journey, we're quite early. So we're at the moment of setting up the infrastructure. So that blue box that allows us to collect data wherever the patient is on that journey in the same place before we start to use it to make those three realities at the bottom there come to life. And TrakCare is really a vital component in that, which I'll go into in just a moment. So again, quite a busy slide, but again, an important one to talk about outcomes. So outcomes is an interesting word. It often gets misconstrued by a number of people. You can mean clinical outcomes, you can mean design outcomes, you can mean operational outcomes for patients. So in fact, we mean all of those things. So once we have a managed and clear workflow that is standardized and a configurable pathway, we can start to hang off each of those components and touch points within that pathway, very clear outcomes frameworks that will support a clinician interface, a patient interface, and a management interface. That will allow us to collect the right information to stick into our data warehouse to create the right visualizations to help us make those decisions, but also to support our regulatory requirements and the requirements of the big beast of the NHS digital team, who need to have that data in order to look at population-wide health. So it's a very, very important moment for us, is to make sure that every single point along the journey has the right outcomes framework attached to it and has the right measures to make sure that we really are looking at what is that quality of life we're putting back into the patient, what is the benefit that we're imparting on that patient, and how do we structure ourselves in such a way that we're making the best progress for them. And finally, all of this bubbles up into one place, and that is NEPA, as we lovingly call it, which is the Nuffield Electronic Patient Record. This is powered by TrakCare from InterSystems, and it is a fundamental cornerstone of our purpose and vision to build a healthier nation. We do this really deliberately, and the ability that TrakCare gives us to connect a patient's journey all the way from the first moment they touch us through to the moment that they leave us for rehabilitation is something we've not had before. And actually, if we approach it in the right way, using user experience design principles and focusing on the task, we know that this could be game changing for us and make sure that we get the data in the right place and in the right structure. And the TrakCare team has been very, very responsive and supportive of that. And really, it is the flexibility of the software that allows us to be able to build something that is relatively complex within the confines of the system. So it speaks to us across three central pillars, and it's really important pillars. And it is, again, all driven about the data. So as I've just described, the data that we collect through TrakCare about our patients and how they move through our clinical environment means that we can help to drive our strategic vision, and also particularly around our purpose. We can really clearly define our outcomes, and we're able to really demonstrate how different we are to all of our stakeholders when we go out to social return or when we speak to patients directly when we're advertising. Safety. So this transparency that TrakCare will give us allows us to really accurately monitor and measure our activities. So in the UK, the senior doctors don't actually work for us. They come in and essentially use our facilities as a third party. So our ability to monitor them and understand what's happening to that patient across that flow becomes hugely important, and TrakCare is a key enabler to that. So we know that TrakCare will help drive safety increases across all the stakeholder. And we also know that if we're able to prove that safety, that increases loyalty and recognition. And finally, user experience. So user experience means everything, right? It means user experience for the patient, user experience for the clinician, and user experience from the management side of things. And we know that if we get this right, that component of our service lines around the clinical side of things will revolutionize the collection of data, because as we all know, if it's a good user experience, then the collection of the data is better, the quality of the data is better, and therefore the outcome and the analysis of the data will become unparalleled. And then finally, we just want to be easier to do business with, and that's the most important thing. We have such a wide range of stakeholders, ranging from the 16-year-old who's trying to get fit through to the 95-year-old with complex bowel cancer, that they need to be able to interact with us in a safe and efficient way. And we know that having a digital front door that is powered by TrakCare will help us get to that point. But we're early in the journey, and it's been great to listen to Michael and understand where we want to get to and how far the Americans are, and really wonderful to speak to you all about where our strategy comes from. So I'll call it to an end there. Thank you very much.